Hi, Bob.
Good morning.
So, we're talking about sciatic pain today, and I know you're not very happy with that kind of pain. So, when did that sciatic pain started?
I guess I've had some back problems for quite a few years. I was a bricklayer, and that's tough on the back. And I went to see a pain specialist that's very good, one of the best in my area. And she took some x rays and she told me that I had some compressions on my L4, L5, no, L3, L4, and L5, and my S1.
Yes.
And the S1 is probably the one that's causing the sciatica pain. Now, it wasn't too bad then, and this was maybe 3 months ago. And during that time, I must have done something because now, very uncomfortable to sit. I have the pain in my back, which shoots across and down my leg and in my buttocks.
So, I think that's pinched nerve. Once you have the shooting pain, that means your nerves are irritated. I think you do have spinal stenosis and bulging or herniated disc. The reason it didn't trigger this pain is it hasn't get to the point that it irritates your nerve. Now, I was looking at your reclining chair, and that chair make you recline. You know, when you watch TV, if you recline for more than an hour or even half an hour, it can put more pressure on your spine. So the treatment you already did, a PT, and it hasn't really relieved your pain.
Well, it is better. Um, it's better, and I have to do the exercises every day, and I have a list of about 7 or 8 exercises that I do at my PT and I do at home
Yes.
at least once every day.
So when you're doing the PT, you have to choose the exercise or stretching which didn't trigger the pain. If that triggers pain, that means that your nerve get compressed more. So first of all, pick the exercise you feel better later. And then second of all, we're doing the acupuncture for a couple of times. That will relax the muscle, and when your muscle relaxed, you can walk a little bit and realign the SI joint. Your SI joint may be slightly out of alignment, and that also make your muscle prone to get tight faster. So first of all, if after acupuncture treatment, you can put some tape, KT tape, or herbal tape to keep your muscle in a relaxing state. And when you watch TV, you want to sit straight with a pillow in lower back to support your muscle. But you don't want to recline. That will relax your muscle but put pressure on your spine. And if I do that for more than 15 minutes or 10 minutes, then my sciatic pain started. And I haven't had that for months.
One of the things that I did that I thought would help is I've ordered about 4 different types of cushions. They all say that they will relieve sciatica pain. Now, I could go to my physical therapy, which is about an hour, and by the time I leave there and I get in my car and I drive home, which is maybe 10 miles away, just sitting in the car driving will aggravate my sciatica. So I've been unable to find any cushion that gives me some relief and would put me in a position to relieve that pressure on my S1.
Yes, so I recommend you doing the acupuncture, combining the PT, and also reduce the time of sitting, because as soon as you started sitting for a little bit longer time, then your muscle get tight. It put more pressure on your nerves. Right now, the nerves are swollen, and that's why it's so easy to irritate the nerve. Until your nerve swelling going down, then you can sit a longer time. But before that, you just have to change position, walk a little bit, lying down a little bit, and right now you cannot do in the pool exercise. Once the infection going away on your toe, then you can go back to the pool, and I think that's the trigger, because you used to go to pool every other day, and then you stopped because of some kind of infection. And then I think after a few weeks of you stopping the pool exercise, then your sciatica kicks in. Is that correct?
Yeah, that could be. Yeah, I do miss being able to exercise in the pool. I would go at least 3 times a week. And the other thing that I noticed is when you have sciatica pain, that's when you realize how much you spend sitting. You know, you sit to eat, you sit to watch television, you sit to drive, you know, to go shopping or whatever. And I can't stand up to watch television. I do get up every once in a while and walk, but the average person spends a lot of hours in the course of a day sitting. And that's why when my sciatica pain is high and I can't seem to relieve that pain, I notice it more because of the hours that I spend sitting.
So I have one suggestion. When you watch TV, I would say at night, probably at least 2 hours, right? And if you're gonna spend 2 hours in front of TV, then you need to lie down. I mean, walking a little bit, sitting a little bit, lying down. Right now, when you lie down, the pain is not bad, right?
Right.
Yeah.
After a night of sleeping, it feels better initially when I get up, and then the pain in the buttocks starts, and then eventually it shoots down my leg a little bit.
Yes, as soon as you put a push pressure on, either standing or sitting or even walking. Walking generally is okay, but now because your nerves are inflamed, swollen, so even walking will irritate that. But I hope you combine PT and hopefully pretty soon water therapy and lying down and also acupuncture to reduce the nerve swelling, and then you can walk more. Thank you.